from the station that's on your side. This is Channel 7 News Daybreak.
The time is 6:23. Arkansas ranks 6th in the nation in deaths from stroke. And to help us get that number down is Baptist Health cardiologist Dr. Anthony Fletcher joining us this morning with great reminders for Stroke Awareness Month just ahead of us. Dr. Fletcher, good morning. Thank you so much for joining us. This is something that I didn't realize we were that high in. Top 10, 6th overall in deaths from a stroke. That's a number that we've got to bring down somehow, sir.
For sure. And actually, the number has improved. We used to be number 1 in stroke, so we certainly have gotten better.
Oh, well, that's good. That's positive, at least.
That's why we're here this morning.
We're taking baby steps, right? From 1 to 6, hopefully from 6 to 12, and so on and so forth. But let's talk about how strokes happen. Maybe something to start things off today. What is the cause of it? Immediate cause, I guess.
Well, the cause for stroke is diminished blood flow to your brain, either complete interruption or partial interruption of blood flow. And that results in you having decreased blood supply and nutrients to your brain. And within minutes, brain cells start to die.
Okay. Symptoms, what do we look for?
Symptoms, basically we look for several things. People trouble speaking. For example, a person has slurred speech or difficult speech, difficulty with eyesight. Your vision is blurred, or you see double vision or blackened vision. Headaches. Severe headaches associated sometimes with nausea and dizziness again. Trouble walking. The person may look like they're drunk. They're kind of wobbling or stumbling. And again, those are some of the major signs of stroke. Okay.
When should we go see a doctor on something like this?
As soon as possible. Time is very important because the sooner you get there, you have a chance of minimizing the complications and minimizing the damage and a greater chance for recovery. So time is extremely important. There's a little acronym that they talk about. If you think about it, it's called Think Fast. And Think Fast, face, look at the person's face, ask them to smile. Is there a decrease in the ability of one side of the face or another? Is it drooping? Arms, ask them to raise their arms above the head. And if one arm drifts, showing signs of weakness, that again is a sign of stroke. Speech, give them a simple sentence and ask them to repeat that sentence if they have trouble enunciating or trouble processing what you've asked them to do. And then finally, time. If you think any of these symptoms are present, time is important. Call 911.
You mentioned restricted blood flow. What causes that? What are some of the risk factors to keep in mind?
Well, risk factors. We've talked many times about risk for arteriosclerotic disease or hardening of the arteries. Lifestyle is very important. So obesity puts you at greater risk for stroke. Social habits, drinking large amounts of alcohol or binges with alcohol. Use of illicit drugs. Cocaine is a major offender. Methamphetamines is another offender. Smoking, again, even if you're exposed to secondhand smoke, that is a significant increase in your risk for stroke also. So our lifestyle is important. Blood pressure, extremely important. Even blood pressure is a little above 120/80. The last time we talked about pre-hypertensive people, they are at increased risk for stroke also. Cholesterol, diabetes, inactivity, all of those are the major potential risk factors. Family history. If there's a history of stroke or many strokes called TIAs, you're at increased risk for stroke. So again, there are many factors that we can modify. How we eat, our exercise, our social habits, very important.
If these risk factors apply to you and you feel like you experience any of those symptoms, make sure you go see your doctor. You can always go see the folks at Baptist Health. There's the Baptist Health line on your screen. You can also go to baptist-health.com. Dr. Fletcher, great to see you, sir. We'll see you next time.
Good morning.
Have a good rest of the week.